Here we go.
All right, well, welcome everyone to today's North Central Region Aging Network webinar. My name is Jim Bates, and I'm one of the network members. I'm located in Ohio, and I want to introduce to you today Professor Marian Liu from Purdue University, and she will be talking about elder mistreatment victims during the COVID-19 pandemic. And let me just introduce her to you. In this webinar, elder mistreatment victims' unmet needs during the pandemic will be presented using data from San Francisco Adult Protective Services. Dr. Liu is an assistant professor at Purdue School of Nursing and faculty associate in the Center on Aging and the Life course at Purdue University. She conducts applied and translational research around elder justice issues, covering topics such as elder abuse, neglect, and exploitation. She works with Adult Protective Services at the county and state levels, and she's also the co-chair of the National Adult Protective Services Association and National Committee for the Prevention of Elder Abuse Research Committee. And prior to joining Purdue University, Dr. Liu was an assistant professor at UC San Francisco. So welcome, and take it away. And I'll go ahead and mute myself. Thank you.
Great. Thank you so much, Jim. So it's a very weird day, you know, with the technology issues, and I have like the mowing the lawn crew outside, so hopefully, you know, it's not too much of a disturbance. Okay, well, let's get started. As the title suggested, I'm going to talk about elder mistreatment victims and during the COVID-19 pandemic. And I'll be talking about their unmet needs during this period of time. And I'm using data like what Jim talked about. I'm using data from San Francisco Adult Protective Services. So it's a pretty small group that we have today. So if you have any questions, please feel free to just ask away. Okay, so first of all, I'd like to thank my funder. They funded this study for the Administration for Community Living. They funded this study to look at Adult Protective Services outcomes. And it's, you know, very different from the project that I'm presenting today. So I will tell you a little bit of a story of how we, you know, got here. But obviously, I would like to recognize my funder. I would also like to recognize my co-authors. So there's Anna Wong and also Sarah Stratum. Both of them helped me doing data analysis, quantitative and also qualitative data analysis. So before we start getting into the project, I just want to very briefly talk a little bit about some of the fundamentals in elder abuse research. So there are different types of abuse, neglect, and exploitation. Some of you probably have kind of, you know, with your job, you know, experiences, probably encountered some of these cases, including physical abuse, emotional abuse, sexual abuse. Financial exploitation and fraud are a little bit different, such that financial exploitation, it's when the abuser or the perpetrator is someone that the older adult knows. And in the fraud situation, it would be a stranger coming into the household, or, you know, online, or like phone scam, those type of things. Neglect and self-neglect. So these are the most typical types of abuse, neglect, and exploitation that has been covered in elder abuse research. Risk factors of elder mistreatment. This line of research has been, I would say, you know, in development for about 15 to 20 years. There are different victim characteristics, different perpetrator characteristics, and kind of the conclusion is that there are inconsistencies between the risk factors. So the two photos, the two images that I put up here is kind of telling you that not all victims look like, you know, the older couple that I put here, but also not all the perpetrators or the abusers look like a devil-ish kind of person, you know, because a lot of the abusers / perpetrators are in fact family members. But then there are some consistent risk factors, and I highlighted social isolation as a significant risk factor for the victims because it's related to, you know, the study that I'm going to be telling you about. Okay, and there are some, perpetrator risk factors that are consistent throughout the studies too. Consequences of elder mistreatment. I wanted to show you all these information just to tell you that, the consequences are not just physical. So a lot of the times it's, the financial loss, psychological trauma, all those different consequences are negative and it impact older populations, probably a lot more negatively than the younger population when they encounter the same thing, partly because, on the financial side of things, it's really hard for the older population to get all the financial losses back at their age. A lot of them are retired. But also, I wonder, there was this study that published back in 2016 that looked at mortality rate between all these different types of abuse. So the ones that I talked about, from physical abuse, emotional abuse, financial abuse. And the mortality rate that is the highest among all different types of elder mistreatment victims is in fact financial exploitation. So when I read that study, I was really stunned because I would think, like the physical kind of harm would leave a mark for sure, right? But I didn't realize that, financial exploitation, taking away people's money can actually lead to a very high mortality rate, which is really interesting. So moving on to talk about adult protective services for just 1 second, because this is the community partner that I have been working with. So the mission of adult protective services is that, this is a social service program aimed to promote safety, independence, and quality of life for vulnerable adults who are in danger or victims of abuse, neglect, or exploitation. So this study, the partner that I've been working with is San Francisco and Napa Adult Protective Services. So these two counties are in California, and there are 9 different types of abuse investigated in California. I'm gonna just kind of see if I can just memorize them, just pull it out of my memory. So starting with physical abuse, emotional abuse, financial abuse, sexual abuse, and neglect, self-neglect, isolation, abandonment, and abduction. So that's 9. So the reason that I'm telling you all about this is because, when I'm talking about the study that we did together, these are the types of abuse that you'll, kind of keep in mind that these are the ones that we covered. And the workflow that I presented here, this chart, is very much simplified. Someone reported to adult protective services about another mistreatment case. So there's intake, and then APS goes out to investigate. They assess the situation of the client. They call them clients. Unless the abuse is substantiated, then they call them victims. And then they provide services, including referrals and actual services. And they close the case when they think the victim is safe, so they can continue live safely, independently in the community. That's when they close the case. So this is a very simplified version because the actual situation of what a case goes through can look very complicated like this. And I would say that even this chart is a pretty simplified version. There is no federal kind of mandate about how APS should work. So counties and states, all APS programs probably work a little bit differently depending on where they are. All right, so now comes to the exciting study. Like I mentioned, the federal grant that I received was to investigate APS outcomes, Adult Protective Services outcomes. So I have been working very closely with San Francisco and Napa Adult Protective Services in looking at quote unquote outcomes. So I'm not gonna go into the definition of outcomes, so on and so forth. That's a completely separate talk. It's during the data collection process. What happened is coronavirus disease 2019. So COVID-19 happened, and there are a lot of concerning issues during this time that led to the project that I'm going to be talking to you about, including the first bullet point. A lot of the COVID-19 risk factors, as it turned out, overlap with elder mistreatment risk factors, including dementia, hypertension. Most of the APS clients, they receive home-based long-term care services, and a lot of them has comorbidities. So based on just, the past couple of months looking at the studies on COVID-19, you'll see that this population, the elder mistreatment victims, this population is at it's at very special risk. They're at higher risk for sure. And then there is the preventative measures of COVID-19, including social distancing, probably not as much as wearing mask, but you'll probably see, why I put it as one of the bullet point up here. Self-quarantine for sure, because I mean, all social distancing, self-quarantine especially, most likely would lead to isolation, social isolation and loneliness. And like I mentioned in one of the previous slides on risk factors, social isolation, loneliness, those are risk factors of elder mistreatment. Last but not least, interestingly, so when COVID-19 first started, I did a presentation for Johns Hopkins, and one of the students asked about number of reports to adult protective services. At the very beginning, at the time it just started, COVID-19 just started, what's the number of report looks like, because in domestic violence it seemed like the number of report, people talked about how the number increased, so on and so forth, because everyone's like in the household together. So I didn't really know the answer at the time, but then I went back to the National Adult Protective Services Association and asked these questions. So as it turned out, and you have to keep in mind that this is when the lockdown and everything first started, the number of report to adult protective services in fact declined, and there's no studies whatsoever on the specific statistics, but just based on anecdotes, the numbers of reports declined when all the stay-at-home order were issued. So that was kind of interesting, and I mean, I asked around and said, well, why do you think that is? And I think a lot of people said, a lot of the caseworkers, investigators told me that it most likely is because, all the eyes and ears, the mandated reporters, they're not seeing the older adults anymore, right, at the time. So this is kind of what happened at the very beginning of the COVID-19 outbreak. I would like to, just add to what I'm saying is, the number of reports to APS as we started reopening, back in May, June, July, those numbers climbed back up again. So it's at the very beginning, the number went down. So because of the declined number of reports, and also, with all the risk factors of COVID-19 and also elder mistreatment that could potentially impact this specific vulnerable population, San Francisco, as one of the first area to issue stay-at-home order, and they call it shelter-in-place at the time, as the first area in the nation to issue a stay-at-home order. Their Department of Disability and Aging Services got really, really concerned about their clients. So they wonder if their client know anything about COVID-19. That's the first question. So they would like to offer some COVID-19 education to their clients. But also at the other hand, they're wondering about some unmet needs of their clients. So if their clients doesn't have, so I have 4 different little pictures here. Does their client have any food, medication, access to medical appointment, and do they feel lonely or not? And if there are other things that they need, they would like to check in on their clients, at-risk clients especially, to fulfill those unmet needs, including making referrals to other agencies in the department, making sure that all the clients are being taken care of. So as one of the unit underneath the Department of Disability and Aging Services, adult protective services also were assigned of this task of checking in with their at-risk clients. So they came up with the definition of what are at-risk clients. So who are they going to be checking in on? So three different criteria. So as long as any of the clients had any kind of confirmed or inconclusive mistreatment investigation outcomes, so results of the mistreatment investigation, as long as something is confirmed or inconclusive, any types of abuse is okay. So as long as they have that in 2020, so that means January all the way to like almost May, because they continue doing this all the way, well, they continue doing it, but just the data that I received is all the way to May. So as long as they have a confirmed mistreatment investigation result, then they are considered at risk client. So the other two criteria is that, as long as the client is over the age of 80, or if they live alone, we consider them, APS consider them as an at-risk client. So they started calling people and asked them about, are you aware of COVID-19, or do you have any unmet needs? And they have all the questions documented, all the answers documented in a pretty comprehensive spreadsheet. And that data is transferred to Purdue University, and my co-authors and I started doing analysis. So some of the results, what are some of the process that they have taken? So first of all, there are 1,313 clients identified as at-risk clients. So they called all of them. Among all these people, 71% were contacted. So not just clients, but what they did is if they call the actual, older adults who are at risk, they call them twice and the clients did not pick up the phone, what they would do is they try to reach out to any of the collaterals they have on their record. So this could be a family member, this could be a friend, or this could be a service provider, case manager, for example. So they try to reach anyone that is in this client's life, really. So and among all these 934 people, some of them they reached directly to the client, some of them they reached the collateral, and there are 20 people out of the 934 refused to speak with APS. On the other hand, about 29% of the people they were not able to be reached, and this include people who they left voicemails and voicemails were never returned. Some of them moved to long-term care facilities, and in California, Adult Protective Services has no jurisdiction in a long-term care facility. And a couple of them passed away, and you can imagine the mortality rate is pretty high, like 38 for the first couple of months of 2020. So out of the 934 clients, what is the demographics information of this group? So on average, this group is about 70 years old, 64% are females. And what I think is interesting to point out is that, this is San Francisco, right? So it's a pretty diverse kind of population such that 50% of the people they reached are minorities. And this is pretty consistent with the kind of profile of San Francisco's demographics, or at least I should say APS demographics, that there's, half of them are like minorities here. And then looking at what types of mistreatment is this group kind of, quote unquote suffering from, 33% of them has a substantiation of self-neglect, and then followed by 19% of the clients who are substantiated with financial abuse, 15% of the clients have a substantiation of emotional abuse. And what I think is most interesting is the very last bullet point, 35% of them had polyvictimization. So what that means, polyvictimization, what that means is that they have more than one type of abuse being confirmed. So let me share a little bit of the findings. Well, first of all, COVID-19 education. So how many people knows about COVID-19 when they were called and when they were asked about COVID-19? So there are 3 different questions that were asked. First of all, do you know about COVID-19? And then secondly, do you know about the stay-at-home order? And then number 3 is, do you have a doctor to call when you have any kind of COVID-19 symptoms, concerns? So overall, 79% of the responses, so out of the 934 people, 79% of them said yes to all 3 of them. So the awareness level is pretty high, like almost 80% of them know about COVID-19, the stay-at-home order, and they have a doctor to call if they have COVID-19 concerns. And then as for the unmet needs, so 75% of them, when they were asked about the different questions regarding food, medication, medical supplies, medical appointment, do you have any other urgent unmet needs, And do you feel lonely? So with all those questions, 75% of the clients answered no, 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 no to all 5 of those questions. So that, I mean, this is the good news. It seems like, the majority of the clients are doing pretty well. And we built a couple of the binary logistic regression model using the previous slides for all the questions, using them as dependent variables. And we used mistreatment type as well as age as our predictors. So we tried to look at, based on all these different dependent variables on awareness of COVID-19 as well as unmet needs, what are the predictors? And you're probably wondering why we didn't include other demographic informations, and that's because we have a lot of missing data on the other demographic informations, marital status, education level. We don't have like information on all the clients on those variables. So the only demographic variable included as a predictor is age. So the first sets of the bullet point talked about predictors of COVID-19 and stay-at-home order. So older persons, older adults, self-neglectors, and victims of neglect, they are more likely to say they have no idea that COVID-19 or what is COVID-19? They have no idea. And then for the stay-at-home order, also, the 3 characteristics being older, being a self-neglector, and also victims of neglect, they're more likely to say they have no idea about, the stay-at-home order. As for unmet needs, this is kind of interesting, and I would really, appreciate feedback on this one. So victims of isolation had trouble getting access to medication. So this one is, I don't think is as surprising. You can understand that, victims of isolation, they're in that bubble, right? Being isolated from other people. And then the second bullet point talked about, we also found that victims of emotional abuse, they reported that they feel lonely. They're more likely to report that they feel lonely, which is also not surprising, I don't think. But the third bullet point, I couldn't really get wrap my head around it, because victims of physical abuse, they're less likely to report that they feel lonely. I mean, I understand why emotional abuse victims would report that they feel lonely, but I don't quite understand why physical abuse victims would state the other way. So if you have any thought, let me know. And then for the qualitative findings, I think we have really interesting information coming out of the qualitative findings information. So there are 3 different things I want to talk about. And the first theme is clients' preparedness for COVID-19. So these are quotes, and I mean, you can definitely read through them. We have some well-prepared clients. So when APS caseworkers called, they said they have everything. They have friends, family, service providers. Everyone in the world is helping them. But we also have some of the clients, which I mean, I think I'm a little bit concerned about that group, because we have some of the clients who said, yes, I know about COVID-19. Yes, I know about, the stay-at-home order, but what can I do? I have no mask. I live by myself. I have to go out. I have to do essential activities. I have to go out to get food and groceries and, so on and so forth. The last group of clients, based on the case notes of APS caseworkers, are the clients who were not aware of COVID-19. So those are most likely people who have dementia or people who had some mental health issues, and they just, have no idea about what's going on. The second thing that we pulled together is clients' unmet need during this time. So the first category is probably not surprising, supplies, right? So food, medication, and other supplies. And we all know that, during the time, beginning of the pandemic, toilet paper and face masks is really kind of, lacking. So through the case notes, we saw a lot of it. And then the second thing about unmet need is personal care. So even though we have some of the clients who talked about, yeah, I have all the caregivers, taking care of me, but we also have some of the other clients who said they would really need, during this time, they really need additional caregiving help. There are some other things people mention, but not in such a high frequency: doing laundry, getting transportation, covering pet supplies, and then paying bills, so on and so forth. Those are the other unmet needs that we identify. Last but not least, about loneliness. I mean, I singled it out because we got quite a few quotes on loneliness. So the first sub thing that we find out of these case notes is that stay-at-home order definitely led to loneliness, because some of the clients talked about they don't have visitors anymore because of social distancing. And this also, kind of included some of the clients who are not tech savvy. So some of the clients are actually very tech savvy, who talked about, oh, I cannot talk to you anymore because I have a Zoom meeting to talk to my grandkids that I have to attend to. But not all of them. So a lot of the older adults who might not have that technology capacity, they're more likely to say, well, I have no contact with anyone anymore. I'm just sitting here in my own house. And then we also observed this finding such that, clients with mental health illness, they seem to be impacted by the pandemic a lot more. So it's not really surprising, but, out of the quotes that we found, there are quite a few clients who talked about, they have this history of depression, or, psychiatric symptoms that seem to be not working out during this time. So summary of what we found using this data set, administrative data set from San Francisco Adult Protective Services. First of all, it seemed like, 3/4 of the clients are doing pretty well, which is very good news. And from what they told us, service providers, friends, and family members were very, very important because they have a support system. So one of the questions that we cannot really assess from the data, but kind of, are asking ourselves is, how are the caregivers doing? Because, I mean, we can definitely kind of tell that there's increased demands coming from the client, because a lot of them cannot, head out to get their groceries, or, would rather not. So how are the caregivers doing during this time? Are there any kind of caregiver burden or burnout, those type of things? We don't really know, but we suspect that if we get to talk to the caregivers, this might be a worthy research topic to look into. And then for the quarter of at-risk clients who needed something, it is quite concerning, I would say, because, I mean, a lot of them said they have to conduct essential activities themselves, which increase their risk of contracting COVID-19. And then with the social distancing and lockdown, that led to higher level of loneliness. That, because loneliness and social isolation by itself is a risk factor of elder mistreatment. So with all these victims, I mean, they were confirmed victims. I mean, they hopefully do not have any elder mistreatment ongoing in their life anymore. But since loneliness is a risk factor consistently in the literature, it is quite concerning, regarding these older adults living situation, and how does that relate to, elder mistreatment risk. Last but not least, even though it seems like most of the people are doing well, only a quarter of at-risk clients needed something. The actual unmet need could be higher, because first of all, we have 29% of the clients who are not able to be reached, right? So if you think about why are they not being able to be reached, is there an abuser? Is there a perpetrator preventing them from picking up the phone? It's a little bit, concerning for sure. And then secondly, because APS called the clients, and this is a self-report type of study. And if you look into the literature, you would notice that, elder mistreatment victims, they're more likely to, there's a higher proportion of them having dementia, cognitive issues, so on and so forth. So especially executive functioning, right? So executive functioning is about planning. So how many of them actually need something, but they don't feel like they need something, and reported that they're doing fine? But as the pandemic continues, are they still doing okay is the big question. Last but not least, the framing of the questions. So I have to say that, because this is data coming from administrative information coming from adopted services, the framing of some of the questions are not perfect. For example, the food question, do you need any food? It's not, straightforward as, do you need any food right now? It is, do you need any food, or do you have any way to get food? So it's two questions really. And I would imagine, the clients need to respond to saying, well, I have trouble with getting food or no food. Like exactly, what is the percentage of them having trouble getting food or needing food at right now at this current moment is a question. And, that could lead to potentially unmet needs is in fact higher. So from this particular study, I mean, one of the big things that I can kind of identify and really want to talk about is how important it is to follow up with this group of vulnerable population. Calling the client was just the first step that Adult Protective Services took on, because Adult Protective Services called them, they identified all the unmet needs, and they have to satisfy those unmet needs. So San Francisco APS, they try to offer supplies. For example, some of their caseworkers started making cloth masks, for those clients who said they would like to have a mask and they did not have any. And later on during the pandemic, they also have access to surgical masks. So then caseworkers would carry some of the surgical masks with them. So whenever a client needs a surgical mask, they would offer them, at least one, so that they can get through, at least a week or so. Also, Department of Disability and Aging Services, the whole department, they have additional resources, including, IHSS, which is personal care for people with Medicaid. And also they have other resources like food, like getting people connected with medical providers, so on and so forth. So the whole department worked together in providing additional services to their clients. Additionally, San Francisco Adopted Services, they also work with community agencies in coordinating care provision. One of the examples is that they tried to coordinate with 2 other community agencies in providing COVID-19 hotels, because in San Francisco, there's a big homeless population. So they provided some kind of, temporary housing. I probably not really housing, but, hotel, so that these clients can stay somewhere that's relatively safe. And also, with this particular study, I have to also kind of mention that APS, not all APS programs can do what San Francisco did, or, they continue doing this. So not all the APS programs can do this type of follow-up and checking with their clients, because not all of them are relatively, as well funded like San Francisco. So there is no dedicated federal funding for adult protective services. So this is very different from child protective services, where there's dedicated funding to run the programs. There's no federal funding for APS to run the programs. So everything that happens is at, like I mentioned, state and also county level. So in California, it's county, but here in Indiana, it should be at the state level. Additionally, with kind of, the resource inequality, you can imagine that clients living in rural areas, they could potentially need also, there's some unmet needs that needs to be met. However, they might experience more unmet needs that is not being met. One of the very clear example is that I mentioned that I have been working with San Francisco and Napa Adult Protective Services together for the federal grant. However, San Francisco was able to carry out this type of wellness check and calls on their client to checking with their clients. And when I proposed this to Napa, which is, a more suburban and also rural area in California, they were like, this is a great idea, but we just don't have that capacity to follow up with our clients. Okay, well, last but not least, I think the next couple of slides are, it's as long as, my presentation itself, but I wanted to also recognize my research team. Although they're not working on this particular project, we have been working on the federal grant together, including my collaborators, Dr. Conrad, Dr. Haas, and also Dr. Conrad. as well as our social worker, Andrew Butler, Dr. Ye, and also Dr. Iris, who passed away earlier this year. Last but not least, I would like to thank San Francisco and Napa APS caseworkers. They have put in so much time into this work, and they do not get any money out of the federal grant. So I really appreciate all their help in doing this with us. All right, any questions?
Thank you, Professor Leo. Well, as you're thinking about those questions, I want to highlight something I just put in the chat. NCRAN and also Dr. Leo would like to have some feedback on today's presentation. There's a link in there, and you can just copy and paste that link into your browser, and it'll take you to just a real brief evaluation. While everybody's thinking, let me just make a comment. I think it's interesting that when you mentioned I have to go on a Zoom call with my family or my grandkids, that some of these older adults were connected with their families, and not just face to face, but also technologically. And so I found that also with my recent grandparent coronavirus study as well, that these individuals are not only learning tech, but they're learning it in the context of using it with their family and also to meet some of their other needs. But yeah, so thanks for bringing that up. That is very interesting.
Absolutely. And I think it's a great opportunity, I mean, very unfortunate to kind of we're experiencing this pandemic, but also at the same time, if, like you mentioned, Jim, like, I think, with my own parents too, what motivates them in learning new technology, right? It's usually family members. And this pandemic kind of forced them into learning about all these new technology to continue getting connected.
Yeah, yeah.
The point, hi, this is Karen from Wisconsin. The point you made about the physical abuse and that they weren't as worried, I'm just wondering if because of the COVID and because of the isolation, the physical abuser wasn't in their living environment. And so they weren't seeing them as often.
So they're actually safer.
Yeah. And I don't know, I may be jumping to conclusions because I don't have all the information, but if you don't have those people coming into your home,
right,
because of the isolation.
That is a very good point. Yes. Thank you so much for that.
Sure.
I think I was thinking about, the victim living with the perpetrator.
Right.
What that dynamic would look like. But you're absolutely right. Not all perpetrators, abusers live with the victim.
Right. Yeah.
Perfect. Thanks.
Different factors.
Yeah.
Interesting information. Thank you for sharing.
Oh, thank you. Yeah, this is not yet published, so I'm still writing my manuscript. So I'm excited to share the information with all of you.
Did anything come up about fire season in Napa County? I know Napa County, or part of Napa County, or close to Napa County, is on fire right now, but maybe this occurred before fire season.
Yeah,
has that,
right.
If that came up maybe as another challenge for these folks?
Absolutely. I think when I reached out to Napa, it was already June because we got the data, and I was wondering if Napa would like to do something similar. And so I think, that's the start of the fire season. And then, when it went into like all the fires everywhere, they were like, yeah, no, I'm sorry, we really cannot take this on. And I also just want to kind of mention, you can kind of see, San Francisco, when I say that they're a relatively well-funded program. So when the fire season started, they were even more committed in this process of checking in with all their clients. So in San Francisco, there's no fire in the city, but there's a lot of smoke and everything like that. So when thinking about, some of their clients that has no AC, that has, no home, no roof over their head, they're checking in with all those clients, making sure that they're doing okay and not needing anything.
Wow. Fantastic. Okay.
This is really fun. I mean, I appreciate the opportunity to share my preliminary results and, this fantastic opportunity in getting connected. I know that, with the technology issues and stuff, probably not everyone could be online today, but, the fact that the recording would be uploaded later, I think it's a great way to still get information shared.
Yes, yes, and we'll get this up on our website, lickety split, and make this available to the people who get our newsletters and email services as well. So thank you very much. Thank you for your time, everyone. Thank you for the input, Karen, and again, just want to draw your attention to that that evaluation link, and it should take just a few minutes to rip that out and give us some feedback. So thank you very much. Take care. Have a great weekend, everyone.
Yep. Have a great weekend. Thank you so much.